All right, why don't we go ahead and get started? Good morning, everyone. My name is Shannon Moore. I'm the Director of State Government Relations at Boston Children's Hospital, and I will be moderating today's session. On behalf of the Office of Government Relations, it is my pleasure to welcome you to today's webinar on ensuring equitable health access for all children in honor of Hispanic Heritage Month. Today, our panelists will discuss the critical need for the passage of one of the top priorities of the Office of Government Relations and Cover All Kids legislation. This legislation would expand MassHealth coverage to children and low-income adults whose only barrier to coverage is immigration status. We will continue advocating for the passage of this legislation in the upcoming session, which begins in January of 2023. Before I introduce our panelists, I would like to go over a few housekeeping notes. If you require closed captioning, please click the feature with the letters CC to enable them. This session is being recorded. You will receive a follow-up email with a link to the recording and a short survey to provide feedback. You can submit questions to the panelists by using the Q&A feature. Questions will be answered at the end of session, providing there is time. If you have any technical issues, please feel free to send a chat to the host. Today, we have a great panelist of guests today. We will hear from Yamina Romulus, a policy manager at Healthcare for All, Carlos Solis, a senior helpline counselor at Healthcare for All, and Dr. Camila Mateo, a primary care attending from Martha Elliott Health Center. With that, I would like to welcome Yamina. If you'd like to turn your camera on, thank you.
Great, thank you, Shannon. So thank you for the introduction, and thank you to Children's for inviting me to speak on such an important issue during a very great month. And so again, my name is Yamina Romulus. I'm a policy manager at Healthcare for All, and my work focuses on policy and advocacy related to child and maternal health. And so before I talk about the Cover All Kids bill, I'd like to take a moment to provide a brief background on Healthcare for All, our Children's Health Access Coalition, and then I want to provide some context and rationale for why we filed the Cover All Kids bill. So Healthcare for All is a healthcare advocacy organization that advocates for health justice in Massachusetts by working to promote health equity and ensure coverage and access for all. And we do this in three major ways, the first being policy and advocacy work, community engagement, and direct service. Now, speaking of direct service, we have a helpline that's actually operated by 7 helpline counselors that take over 20,000 calls a year in 4 different languages: English, Spanish, Portuguese, and Haitian Creole. And our helpline counselors essentially help Massachusetts residents navigate what we know to be a very complicated healthcare system. So they're helping individuals answer any questions that they may have regarding health insurance. They're helping connect them to different services. They're helping to them apply to different public benefits. That's just to name a few things that this helpline does. And you'll actually hear more about the types of stories that are coming through our helpline from my colleague, Carlos Solis, later on. But I will say that it's because of what we've been hearing through our helpline and from other partners that we decided to work with our legislative champions to file a bill that would ensure comprehensive mass health coverage is available to all children in the Commonwealth, regardless of immigration status. Now, before I get into the details of the bill, I do think that it's important to highlight our great and amazing coalition that has led the bill for the last 2 sessions, and that's our Children's Health Access Coalition, also known as CHAC. Now, CHAC is Healthcare for All's longest standing coalition. It's been around since 1995, which is a really long time. And CHAC is comprised of providers, community organizations, child advocates, and other stakeholders that are all committed to ensuring that all children in the state have access to and receive age-appropriate, comprehensive, and affordable healthcare services. So, what is the problem? Why do we even need a Cover All Kids bill? So despite over 98% of children in Massachusetts having health coverage, there are still 30,000 children and young adults that simply don't have adequate coverage because immigration status is their only barrier to qualifying for comprehensive mass health coverage. And while many of these children and youth are eligible for safety net programs, those programs are limited. In other words, they're not covering necessary things. So we're talking about durable medical equipment, for example, wheelchairs. Kids don't have a way to get around school because they don't have a wheelchair. No coverage for eyeglasses. How do we expect children to learn if they can't see? There's no coverage for hearing aids, certain prescription drugs. There's a number of stories that we get from children that have asthma that could easily be treated with an inhaler, but they don't have coverage for the inhaler. So what's happening is these kids are ending up in the emergency department. And as you can imagine, that's costly for the family, but it's also costly for our healthcare system. And it also just takes up a lot of time. And not having adequate coverage can also lead to a plethora of other issues, including worsening health conditions, costlier healthcare interventions, as I mentioned, emergency department use, longer hospital stays, and untreated health care problems can also lead to children experiencing cognitive, behavioral, and physical disabilities, and also to develop chronic health conditions. There are also broader implications, effects on school performance, lifelong health, and future earning potential. Now, I've talked about a lot of the impact that is, the direct impact on children, but I think it's also important to note the direct impact this has on families. So inadequate coverage can often put additional stress on families who are already experiencing barriers to linguistically and culturally responsive care. They're facing trauma, they're facing discrimination, economic insecurity. These families are going through a lot, and inadequate coverage is not something that they should be dealing with. So for the past 2 sessions, CHAC has filed the Cover All Kids bill to address some of the challenges I just mentioned. And the bill has been led by our champion, Senator Sal DiDomenico, and Representative Dave Rogers. And the bill would expand comprehensive MassHealth coverage to all young people under age 21 who are otherwise eligible, regardless of immigration status. Now, several states have actually expanded their Medicaid programs to cover all otherwise eligible children, regardless of immigration status. And those states include California, Washington, Oregon, Illinois, New York, and Washington, D.C. Connecticut and New Jersey have also passed similar measures. And interestingly enough, outside of New Hampshire, Massachusetts is still the only New England state that has not expanded coverage. Now, regarding the current status of the bill did end up in Senate Ways and Means, and so it didn't quite get across the finish line. However, I will say that we were able to get this bill a lot further than we were able to during the last session. And that's honestly thanks to advocates like you. However, I think in looking towards the upcoming session, we want to really ensure that we're building momentum earlier on in the session and that we're keeping that momentum going. And my hope is that we can build that momentum, we can amplify the voices of children and families in the Commonwealth by building new partnerships, by engaging new advocates who can all help this bill pass. And so oftentimes I get questions from folks around, how can I get involved? How can I help advocate for the bill? There are so many different ways, and I'm not going to go through all of them today, but I do want to recommend a few ways in which folks can get involved. So the first would be signing up for our CHAC email list. I think that's a great way to be kept in a loop on things such as various action alerts. For example, sometimes we'll put out a call for folks to reach out to their legislators and voice support for the bill. A legislator's job is to represent you, and it's important that they're hearing about the issues that their constituents are facing. And I'm happy to include my email in the chat or have folks from children circulate that information if you're interested in getting added to our email list. There's also the sharing of stories. Stories are so powerful and are one of the key ways in which we can show legislators why this issue is important and why they need to take action. And so we're always looking for impactful stories to include in our advocacy work. And then lastly, I'll say there are other opportunities, for example, providing oral testimony, written testimony in support of the bill. And so I want to conclude by saying every child deserves equitable access to affordable and comprehensive health coverage. And this upcoming legislative session is an opportunity to pass Cover All Kids and ensure that immigrant children have a chance to actually thrive in the Commonwealth. So my hope is that we can do that with the support from people like you. Thank you.
Thank you so much, Amina, for all that information. It's so great to hear about all the hard work that's going on. And thank you for telling us all the things that the bill would help with. The next speaker we have is also from Healthcare for All. I'd like to welcome Carlos Solis, a senior helpline counselor, who's going to talk a little bit about the helpline. Carlos, I welcome you to our chat today.
Thank you, Shannon, for the introduction. So my name is Carlos Solis. I've been working for Healthcare for All for more than 15 years and helping the immigrants community to have access to the health insurance here in Massachusetts, and also helping them to understand the complex of the healthcare system that we have here in our state. So today I'm going to share a few stories about what I do at the helpline. And one of the stories is Carla Uluan and her husband, Nelson Perez. They are family of 7 from Guatemala who have been living in Massachusetts for more than 21 years. So they have 5 kids. 3 of those kids are disabled. One has cerebral palsy. Imagine to have 3 disabled kids and one parent is just working. So one day, and I'm gonna tell this story about this family. One day, Carlos, who is the one who has cerebral palsy, his wheelchair was stolen. Carla and her husband went to the police station to file a complaint about it. An officer who took this complaint, when he saw the situation, I think he got really angry about it, that he did everything to get this wheelchair back to Carlos. So this family, they were without the right health insurance, to protect those 3 disabled kids, plus the other 2 also that they need healthcare as well. So the officer, in addition to, to get the wheelchair back, he did some research and found my direct number and called me directly and explained the situation and asked me if I could help this family to get a better coverage because they had just a benefit through MassHealth and they need a better coverage under MassHealth. I told him, give my number to Carla to check her case and see the way that we can help. So Carla's called me almost right away and I checked the case and I saw that they could be eligible for a better coverage under MassHealth. And now for more than 10 years, I've been helping this family to keep the coverage that they have now. And you can watch this story on our website if you want to know more about it. So finally, this family end up with the right coverage, and now they can get the right medical treatment for their family, and especially for the kids that they are disabled. So another case is a mixed family. She is from Nicaragua and her husband from Brazil. But her husband is in Brazil right now because he is in the process to get his immigration status. Their child, who is 1 year old, developed cancer. I didn't know that, a little child can get this type of illness. So mom was getting, all those medical bills because the child was not enrolled in MassHealth when he was born. So she was so stressed because her child has cancer and because her husband was away and because she was getting all those medical bills. Imagine all the stressful that she was going through. So finally, someone gave her my direct number and I was able to put the child on MassHealth standard. Now the health of this child is getting much better. And mom had less stress because the child is no longer in the situation that was before, and she's no longer getting all those medical bills. So just yesterday, and this is a story that I got yesterday, a single mother from Ecuador has a child that needs dental services as soon as possible. For months, this man was trying to get a better health insurance for the child, but was told over and over again that this child just qualified for a benefit under MassHealth because his immigration status. Therefore, so the child cannot get the dental treatment that he needs as soon as possible. Someone gave her my direct number and I was able to help them to get a better coverage because they are under PROCOL. Everyone who has PROCOL can get family assistance under MassHealth. And this program is much, much better than a benefit. And for the first time in months, this child will see a specialist dentist that will help him to stop this horrible pain that he had for months. So mom was so happy about it, and she finally see a resolution about this situation with her child. And the last case that I want to share with you, so I see many cases every day, but one of those cases that really touched me in those 15 years that I've been working for Health for All is a single mother from Guatemala who has a child that was born without arms and legs. In addition to that, the child has other medical conditions that he can't eat normal, just like you and me. So he has to be feeding by tube, and it's really painful for the child and also for her mom that is trying to get her child back. So because the child is in process to get immigration status, he was eligible for a better care, and I was the one who helped him and helped this mother also to get a better coverage for the child under MassHealth. So now she has this release that no longer she's gonna be suffering because the child cannot see a specialist because he has just a benefit under MassHealth. So this is one of many cases that I see, and here at the helpline we see every week, every day, so the entire year. So immigrant families suffering because they are not getting the right information to have access to the healthcare system, and also is one of the reason that I've been for so long a healthcare for all. And if you have more question about it, more than happy to answer. But thank you so much for having me.
Carlos, thank you so much for taking time out of your busy day to share the family stories, and so much for all of the work that you do working with families. We're so happy to have you here today. I now welcome all of our panelists to come onto camera, and we're going to have a Q&A. If you have not already submitted a Q&A, we can either use the Q&A function or type it right into the chat, and we will work to get through some of these questions that we have. So the first question we have, I believe, is for Yamina, but anyone else is welcome to pop in if they feel appropriate. What do you think are the legislative and executive branch barriers to getting all kids, including undocumented immigrants, fully covered?
That's a great question. So from my understanding, it seemed like an issue around priorities. You know, there are so many bills that are being filed that sometimes legislators aren't deciding or acting upon them, unfortunately, until the very last few weeks of the formal session. So that's an issue, prioritization. And I'd say the same for the executive branch, you know, balancing other priorities for MassHealth and other programs. And so I think ultimately that's why we need the help of advocates to make cover all kids a priority for legislators this upcoming session.
Thank you so much. The next question is for Carlos. How many callers do you get to the helpline each day? And feel free to elaborate on repeat callers or new callers, or however you'd like to answer the question.
Yeah, so this is funny because yesterday our schedule is, you know, from 9 to 5 p.m. But I think just yesterday, I was counting all those calls, and I took more than 30 calls yesterday, and so more than 30 people, they were able to get help, and with the right cover under MassHealth, Health Connector, or any benefit under HSN and Children's Medical Security Plan.
Thank you so much. This question, I believe, is for Yamina. Do we have any estimates on the cost-benefit ratio of having all children under MassHealth, regardless of immigration status?
So there are definitely state budget implications for implementing this policy, but there are also financial systems and, most importantly, human costs for not extending MassHealth coverage to immigrant children and youth. And so, you know, the state is already paying for a group of fragmented safety net programs that already are leaving out really important services that kids need to stay healthy and to address their chronic conditions, some of which I mentioned earlier. But this often results, you know, when a child doesn't have the access they need to certain health coverage or health services, this often results in an overall cost of the system, especially when you're looking at the future of these children. You know, as they get older, they experience worsening healthcare conditions, which can also get pretty expensive. So, and then lack of coverage also just has an impact on other, you know, sectors such as school, things of that sort. So there are implications, budget implications for this policy, but also just important to note that there are human costs also to not implementing this policy.
Thank you so much. We have a couple more questions. One, I'm going to open this up to anybody who thinks they could answer. Have you ever seen a family resort to voluntary involvement with the Department of Children and Families in order to access services, especially mental health services? And if families do become involved with the Department of Children and Families, do children have access to MassHealth standard through that method?
Well, the system, how it works in Massachusetts, and unfortunately, the only way that you can be eligible for MassHealth standard is if you have no immigration status, like if you're a woman and get pregnant and you're making less than 130% of the FPL. So that is the only one that you can be eligible for MassHealth standard if you meet this qualification. And unfortunately, children that they have just children medical security plan, it's really hard to find community health center nearby, and I'm talking about here in the area of Boston, to have access to mental health and have access to other type of specialties for them. So it's really hard for this type of population to get access to a specialist.
Thanks so much. One last question, and I think this might be an easier one, but under this legislation, would MassHealth coverage end right when children turn 18? And are there any services available to help people transition after they age out, if you will? I think the age might be a little higher than 18, right, Yamina? Did you say 21?
21.
It's 21, yes.
I don't know if there's currently any services available to help people transition, but that's certainly something we can consider as advocates as we, think about what happens after we get this legislation passed. All right, well, I want to thank our panelists so much for taking the time out of their busy days to come with us. We will send out an email to all the participants after the presentation. If folks want to get involved in our advocacy network, they can come to, they can visit our sign up on our CAN, which I think is being dropped into the chat, or email us at can@childrens.harvard.edu. And just thanks again for everyone coming to participate today. Please feel free to reach out to the Office of Government Relations here at Boston Children's Hospital if you have any follow-up questions that you didn't get answered today. And once again, thank you so much for our great panel today. And with that, I will leave everyone. Have a great day.